Hello everyone, the title of this presentation is Reducing Criminal Recidivism, Improving Futures and Communities in Metro Atlanta, and the presentation is by myself, Victoria Head. By the end of this presentation, my goal is to present to you a comprehensive program that can be implemented in Metro Atlanta jails and prisons to help reduce recidivism with current inmate populations. Though this project will have a psychological foundation, crime and incarceration affect everyone in a society. They affect the victims of crimes, they affect the incarcerated and their communities, and even if you don't fall into either of those categories, if you pay taxes, crime and incarceration affect you as well. And in America, we have continually had high national recidivism rates, which means people that have been convicted of crimes reoffending. Additionally, trying to reduce recidivism rates is a preemptive action to keep people from re-encountering law enforcement and legal systems. For the rest of the presentation, we're going to hit 4 main points. First is recidivism. We'll look at what recidivism is and who's most affected by it. Secondly, we'll look at current and past approaches to reducing recidivism. Third, we'll look at crime according to the humanistic psychological theory of Dr. Donald Snygg and Arthur Combs. And fourthly, we'll look at rethinking recidivism and how to come up with a better, more comprehensive program that can be implemented in Metro Atlanta jails and prisons. In its most basic form, recidivism can be defined as criminal reoffense after previous conviction. However, there is a large question about arrest and conviction and when to count recidivism rates. Basically, the question is, if an individual has a previous criminal record and they are arrested, do we count them as recidivists at that moment, or do we wait until they are actually convicted of a crime in court to count them as a recidivist? For this presentation, because one of the motivations is preemptive action to keep individuals out of both legal and law enforcement systems, we will be using the arrest definition of recidivism. Nationally in America, we have 2.3 million incarcerated individuals, and we have an 83% recidivism rate. So what that means is, of those 2.3 million individuals, 1.9 million of them will end up reoffending and back in the legal system. In a 2018 report by the U.S. Department of Justice, men are most likely to become recidivists. Additionally, age is also a risk factor. Being under 30 years old, and particularly under 24 years of age, is also a risk factor for reoffense. Most reoffense crimes occur within the first 2 years after an individual is released from incarceration. Additionally, people who commit crimes involving guns are 68% more likely to become recidivists. Race and recidivism present an interesting question because, according to some reports like the 2018 U.S. Department of Justice report, they show race to play a minimal impact in recidivism rates. All of the races in their report are less than a 10-point gap apart. On the low end of that spectrum is Caucasians and Asian Americans and Pacific Islander descent Americans. On the high end of that spectrum is African Americans and Native Americans. However, according to other sources like the Marshall Project, race does play a role in recidivism, and African Americans are most affected. There are protective factors, though, against recidivism. These include education, having a social support network, being involved in a religious affiliation, having stable housing, being open to intervention, and having coping and problem-solving skills. Additionally, in a study done by Copeland and Olver, they showed that men convicted of violent crimes that had increased protective factors were less likely to become recidivists. Trying to reduce recidivism isn't a new problem, and there have been many programs put in place to try to achieve this goal. Many of them center around the idea of restorative justice, which has to do with rehabilitation of the individual. Many of these programs also focus on education, since education is a protective factor against recidivism. In a meta-analysis of these programs, they were shown to be anywhere from 43 to 13% effective at reducing recidivism for individuals that participate. Snygg and Combs understand the world through the concept of the phenomenal field. And the phenomenal field is how someone understands the world that they're aware of, and it's a very subjective concept. However, it's not a stagnant concept though. The phenomenal field can have different facets, and these facets can be brought out in different situations. So a person's understanding of the world isn't flat, but it can be dynamic and situational. The most important part about the phenomenal field for Snygg and Combs, though, is that they thought if you could understand the phenomenal field, you could then predict an individual's behavior. Additionally, it's very individualistic, so there is no abnormal or normal behavior for a whole population. Rather, it's normal and abnormal behavior for a given individual within their own individual field. The phenomenal self is the most basic need according to Snygg and Combs, and it's how an individual views themselves, and this can be preserved at all cost. It is to be noted, though, that a person's physical body is not included in the phenomenal self, which might include why individuals partake in violent crimes. Threats are anything that come against the phenomenal self, and Snygg and Combs explain criminal behavior as the inability to cope with or resolve the threat. Learning is defined as when confusion is removed from an individual's phenomenal field. Additionally, for that learning to be meaningful, it has to be directly relevant to an individual's needs. Given the understanding of the world, therapy for Snygg and Combs is very much so about dealing with threats. There has to be a renovation of the phenomenal field and the phenomenal self to deal with how threats are taken in and resolved. If one can better learn how to either cope with or resolve threats, therapy has been effective. So you may be wondering why we're looking at Atlanta to implement this program. Well, in Georgia, the incarceration rate is 31% higher than the national average. Additionally, 40% of the Georgia population has a criminal record, and within 3 years, the rearrest recidivism rate is roughly 66%. The program that I would like to present to you is based on Snygg and Combs' theory, and it's a 3-part comprehensive program that focuses on educational opportunities, phenomenal mapping, and situational exposure. Learning is impactful in removing confusion from an individual's phenomenal field. Additionally, having an education is a protective factor against recidivism. I would advocate for increased GED and Pell Grant opportunities for incarcerated individuals. The second part of the program is phenomenal mapping. And phenomenal mapping can be seen as similar to narrative therapy, where the therapist and the inmate narrate out both the phenomenal field and the phenomenal self. This is to include the inmate's experiences as well as their internal cognitions and values. By mapping out both the field and the self, the therapist and the inmate are both able to understand their behavior and predict their behavior. The third part of the program is situational exposure. This would first be done verbally, with a therapist introducing an inmate to threats to their phenomenal self. These would be situational to either domestic, workplace, or community situations. The goal of situational exposure is for inmates to be able to identify threats, be able to cope with them, and then resolve them in an effective manner. As the individual progresses with the situational exposure coping skills, the therapist could then introduce them to experiential exposure, where they are exposed to role-play type situations. While phenomenal mapping is a part of the program that would need to occur between a therapist and an inmate one-on-one, situational exposure can be done either individually or as a group. However, the benefit to doing it individually is that the therapist could customize the exposures and the threats to the individual's phenomenal field and phenomenal self. So this is our comprehensive program that we are presenting to be implemented into Metro Atlanta area jails and prisons. This is a preemptive action program aimed at reducing rearrest recidivism rates. According to Snygg and Combs, if we can understand an individual's phenomenal field, like through the process of phenomenal mapping, we can understand and predict an individual's behavior, including their criminal behavior. This would allow us to preemptively renovate those cognitive processes and threat detection systems and reduce and potentially eliminate all criminal recidivism. This will conclude my presentation. Thank you so much for listening, and if you would like any more information, these are the references used in compiling today's presentation.